So for the final presentation, we return to the issue of marketing of unhealthy foods and drinks to children, a topic that has been mentioned and somewhat addressed by previous speakers here today. And it's a pleasure for me to present a European network that has just been formed that is trying then to work to help reduce the overall marketing pressure. It is clear that marketing of foods to children is extensive, and the majority is for products that we do not recommend or that's very high in fat and or sugar. A study by Robinson and colleagues from last year demonstrate very clearly how the marketing works with children. They presented hamburgers and chips that were wrapped in McDonald's wrappings and had alternative or same product wrapped in neutral wrappings, and the children clearly preferred the products that were wrapped in McDonald's, and this went even for baby carrots and milk. There is a growing evidence-based linking marketing to children to both eating behavior and obesity. And the first systematic review that was done in this field was by Hastings and colleagues in 2003. And they were able to demonstrate that, one, there is a lot of food advertising addressing children. The advertised diet contrasts sharply with the recommended one. Children clearly recognize the advertisement, they enjoy it and engage with the food promotion. It has an effect particularly on children's preferences, their purchasing behavior and also their consumption. And this effect is independent of other factors and operates at both brand and category level. Hastings and colleague did a new updated review in 2006 and again were able to demonstrate that food promotion influenced children's food preferences, purchase behavior, particularly the way they influence their parents' purchasing behavior, and consumption level. And this was the case not only in developed countries or Western countries, but also in developing countries where children might be even more vulnerable to this type of advertising as they are less used to it. Also from 2006, the Institute of Medicine in the US gave out a very extensive report that basically told the same story, that there are evidence that here they looked at food advertising on TV has an impact on young children's food preferences, purchase requests, and also consumption patterns. I think it's very important to recognize that marketing is more than advertising, and the literature has very much focused on TV advertising, both the research literature and in the statutory regulation and restriction that has been implemented so far. Like for example in countries like Sweden and Norway, there is regulation on TV advertising targeting children directly. So one definition on marketing is that it aims to get the right products in the right place at the right price, while advertising or the promotion component is simply then to inform or tell about the products. Just last month a report was published here from Denmark showing that there was a vast number of new marketing methods, especially on internet and cell phones. And also that commercials and other content of the media increasingly melt together, so in games, competitions, films, etc., making it much harder both for adults and researchers, but particularly for the children, to separate what is promotion or marketing and what is games and information. This just shows some of the all the different sources of marketing that is being used with media and other methods. So you have the broadcast media, you have promotion or marketing at the point of sale, so in stores, product packaging or content in school as an important arena, and also the use of other media. It is important that policies in this area is based on good evidence of what is effective, and also the issue of cost effectiveness is important. And there's one very interesting study that was conducted in Australia where they looked at the impact of 13 potential obesity prevention intervention in children and adolescents. And they did a study then where they looked at health gain, studied as body mass index units, and then this was converted into lifetime dailies saved. And as I said, there were 13 different interventions, ranging from school-based intervention, community-level intervention, and so forth. But the intervention assessed to have the biggest population impact was restriction of TV advertising of high-fat and or high-sugar foods and drinks to children. As had then been mentioned earlier today by other speakers, there has been a call for action in this area, and the WHO Global Strategy on Diet, Physical Activity and Health from 2004 pointed to this area as an important one to address. And during the World Health Assembly in May last year, there was a call for WHO to develop a set of recommendations on marketing of foods and non-alcoholic beverages to children. And that was just followed up earlier this month during this year's World Health Assembly, when the Assembly approved of the action plan for the prevention and control of non-communicable diseases. Similar action has been taken at the European level within the WHO, and specifically pointed to in the second WHO European Action Plan for Food and Nutrition policy that was passed last year. And we also find similar language in Nordic documents, so the Nordic Plan of Action on Diet and Physical Activity from 2006. There has been called by experts, consultation that WHO have conducted, and also the UN Standing Committee on Nutrition. And then there are non-governmental organizations working in this area, and for one thing, the International Code on Marketing was just passed this year by Consumers International and International Obesity Task Force. It's an important document, as is the Sydney Principles.